The demand on the healthcare system is so great now that clinicians and patients themselves need the support to drive better patient outcomes.
The potential of data analytics in general in healthcare is just absolutely enormous. It's the case that lots of people haven't had the opportunity to analyse it at scale like other industries might have done.
There's 56 million people live in England. We'll each have on average 6 healthcare consultations a year. Now, that is just niche healthcare. When you include the personal data that you collect from your Fitbit or from your phone accelerometer or information you've had about yourself, the data set is massive.
Innovation is the most important to healthcare organisations as they solve the challenges of increased demand for services.
Most of the exciting and interesting unanswered questions in medicine today can only be answered with data at huge scale.
The better insight you have and the quicker you can get to that insight, the quicker you can improve the way you treat a disease or building new vaccines, for example.
Unlocking the potential of routine healthcare data is really huge, and there are really 3 main areas where this can have an impact. The first of which is operational support, the second is clinical decision support, and the third really is around what I would consider patient support.
Using the cloud and some of the powers of modern technology is the only way you could begin to process this kind of quantity of data. With the vision of the analytics platform of bringing that data together, you can start to track the entire patient's journey through primary care, secondary care, and pharmacy in a way that just wasn't possible before.
Most queries across huge, very, very large health data sets can be done in seconds, maximum minutes.
This data that we can pull will be joined with other data that allows us to develop those kind of insights in the way that many other industries have been doing for years and years. And what we're seeing with this tool is a component part of our journey to using data ultimately to ensure that patients get better treatment, their diseases, their problems are dealt with in a timely manner, and hopefully they'll live longer, healthier lives.
Technology in this space is changing incredibly rapidly. We'll be using them further to help people understand prescriptions and predictions about patients' behaviour going forward.
It's going to have researched the first time a platform where they can create, test and implement algorithms to help improve healthcare outcomes. And that's going to be where we'll see the real power of EMIS-X come through.
Driven by data and analytics, we'll see AI move into primary care. So it's much more rapid, coal-face analytics, making rapid changes, rapid iterations, and being able to evidence the impact of those.
I think everything we can do to push forward the better, safer, faster and cheaper use of data at scale is to the good of everyone.
This has the potential to completely change the way that we deliver healthcare. It has the potential to change the intrinsic role of healthcare professionals, such as a doctor, and it has the potential to massively change how we organise our services.
What we will shift from is reporting what happened 3 months ago or a year ago to what's going to happen tomorrow, what's going to happen in 3 months' time. Pinpoint, predict and prevent. We want to identify people and predict when they're likely to deteriorate, and we need to respond and react quickly so that we improve the general health and well-being of our overall population.